this GIU interview, I'll be speaking with Dr. Griffin Benjamin, who has been the visiting consultant psychiatrist for the Ministry of Health here for the past 10 years. This month, August, is actually his last visit to the island. So we thought it was important to have a chat with Mr. Benjamin to find out more about his contribution to the health sector. Dr. Benjamin, how are you doing?
I'm fine. Thanks for this opportunity to talk with you and with the people of Montserrat.
Of course, and thank you for consenting to the interview. First
My
of all,
pleasure.
tell us about your role here over the years as psychiatrist and how frequently you would normally visit the island.
I started off in 2008, that's about 10 years ago, and I came, the arrangement was that I would come every month. I think for the first year or two, I came once a month. I spent a week and head back to Dominica. After the first year or two, the arrangement changed where I was only needed to come every 2 months. So from probably 2009, 2010, I've been coming every other month. My role continues to be the same, despite the frequency of the visit. My role here over the last 10 years was basically to understand persons who consulted. So clients who were referred to me by the other primary care doctors and the other departments of social services. My job was to understand the clients. Probably if then there was a need for a clinical diagnosis, I would make a clinical diagnosis. I would recommend treatment. And for those who are mostly disabled with mental diseases, psychiatric illnesses, my job was to stabilize them, get them back to a functional state where they could care for themselves or allow themselves to be cared for. And I came in 2008 on the background of the fact that the government started a program called for mentally challenged program, a program funded by DFID, and I am the psychiatrist who was hired to study these clients who needed proper shelter and stabilize them and maintain their stability through proper treatment.
Right. And how many clients roughly are we speaking of?
Well, I know the housing solution entailed about 60 or more clients. But of course, not everybody who needed psychiatric care needed housing solutions. Some had their houses already, families were taking care of them. So in all, I think the numbers that we have been dealing with since I'm here is between 120, 150 clients from the population, from the Montserrat population.
Right, and we know that there are a variety of mental conditions that you address, but what are the common ones that you have been treating here over the years?
Well, those that required public help, the entire system in Montserrat seemed to be public in that the government funds and pay for the care of the clients that I'm treating. And most of those clients would suffer with a disabling psychiatric condition like schizophrenia, bipolar disorder, some depression. Many of them had comorbid conditions, meaning they suffered with substance use problems. Either the conditions that they suffer with were secondary to drug use, or they were coexisting with substance use. That means they had dual diagnosis. Others had social issues, which are not so far-fetched in a Montserrat setting because of the trauma that people endured through the volcanic eruptions. A lot of people who would have been stable, their families migrated somewhere in the early part of this 20th century. And because of that, the people that they depended on for support on a daily basis migrated to England and the United States. And so their need for social and government support increased. And so those are the type of persons I met and had to participate. Many children form part of our treatment program also. And many social cases from the social services department form part of my clientele.
That's an interesting point you just raised there in terms of, many children. Can you say at this point whether or not you've seen that number decrease or increase over the years from when you first started?
Okay, the obvious answer to that question, yes, the number of children seeking psychiatric care from consultant for psychiatric care decreased. I don't think it's because the number of children who needed psychiatric care decreased. It's more the fact that when I came here in 2008, a very special colleague, Dr. Clarice Barnes, came to the clinic and said to me, Dr. Benjamin, I have a number of clients at the Montserrat Secondary School and at the other primary schools on island, and these clients I need help to diagnose and treat them. And I immediately got up and we started a clinic at the pupil support unit. And that clinic went on for maybe 8 years. And it went on for about 8 years. The last year or so, something went wrong and it fell apart. And the children, in my view, were denied the type of care that they could have gotten.
Now, over the years, what are some of the main observations in terms of trends that you would have picked up here as it relates to the detection, prevention, and treatment of the range of mental disorders that you address?
The trends. As I just mentioned, the pupil support unit was I always flank it as one of our best programs. When I speak about psychiatry in Montserrat, I always say to the Ministry of Education, they need to copy Montserrat, because Montserrat has a pupil support unit located within, just on the border of the Montserrat Secondary School, with a PhD educational psychologist working with the principal of the school and the teachers and the parents to understand children with difficulties. And whether you like it or not, 20% of the children in any school would have a difficulty called mental illness. And unfortunately, these children in most of the systems that I am working in currently are denied proper mental health care. In Montserrat, on the other hand, because of the pupil support unit, because of that policy of the Ministry of Education to understand children with difficulties, I found myself working in collaboration with highly qualified persons like Dr. Barnes and recently Dr. Kelly, where we would help parents to understand why their children are having difficulties, help the teachers and the principal to understand what can be done with a child who has special need, just need for education, need for family understanding, need for social support. And that is one of the trends that we started. I still think we haven't lost it, because whatever we did together with the teachers and the parents and the children, I think they're still doing it. But because the mental health unit program sort of fell apart in the last couple of years, I think we can see it as a trend that needs to be restarted. Other trends that I am feeling proud about is the success of the home visits that we have done, go to people's home and treat them. I think it's part of the primary care system of Montserrat, but more so the resolution that the government placed on homelessness in Montserrat. I mean, Montserrat probably don't see it as homelessness, because after the volcanic eruption, people were placed in shelters. Now, these shelters, when I arrived in Montserrat years ago, these shelters were not very nice place for accommodation. People were living in these little rooms, in these almost broken down facilities. And over the last 10 years, I've seen the construction of at least 60 duplex single homes, or even the warden-assisted Oriole Villa apartment. And these homes are primary homes. They are first-class homes. They are real good conditions for people with mental illnesses or mentally challenged or any disability, physical or mental. And that's one of the trends I see in Montserrat, which is second to none in the Caribbean. Most of my patients would love if our government could come up with a program and build such facilities, and give them a second chance, because they can't do it on their own. It's not possible for the group of people I'm describing here, the mentally challenged, the mentally disabled, to come up with funds, banking relationship, jobs, resources to construct for themselves dwelling homes and maintain them. And the Government of Montserrat, through its help from the DFID and through its recruitment of people like me and others, were able to run this program. And if they are boastful of it enough, it can be an example to all the other islands in the Caribbean as to what can be done to help people who are disabled and in need. So that's another trend that I think, that's the second most positive trend, or probably the first of the two trends I've observed in Montserrat, for which when I leave here, anywhere else I work, as I'm working now in Dominica, we're trying our best to implement this same program of providing accommodation and shelter for people who are homeless.
Right. Now, going back to that point about the pupil support unit, I think it's important for me to mention that I know the Ministry of Health and Social Services, they do have a child safeguarding program, so I have a feeling that that would have been absorbed into that. Now, as we go back to looking at patients who are dealing with different mental conditions, are you seeing with the implementation of the the housing program to accommodate persons with different disorders and other initiatives that would have been implemented, are you seeing a vast improvement in the treatment, the results for the patients?
Yes. I can say that the 60 or so persons who are living in the government-assisted housing, I would say their quality of life is significantly better. In the first 4 years of implementing the housing program, 2 of those years we had 0 admissions to the hospital. In 2011 and 2012, there were no admission to the Glendon Hospital of patients who were frequently admitted there. And the reason for that is we had stabilized them, we had placed them in humble accommodation, the nurses and the doctors visit, or they visit the health center, and they maintain treatment and they maintain their wellness. So the quality of life, some of them became job owners, that means they worked. Government continued to provide financial support through the supermarkets and through their families to keep them stable. And so the housing solution, the fact that they could rest, bathe, eat in one place, even if they were on the streets, and if you walk around the Lime we call it, Cape Wireless
yes,
place
flow,
there,
yes.
flow, you would see them sitting around there, but they're clean. They might beg you for $1, but they are not fighting you for $1. And they are clean, and they are decent, and they are not aggressive. So I have to say that if there's any success in treating persons with mental illness, it's not because of the medication we give them only. It's because of the fact that they could find a place to sleep, rest, and feel like a human being in their own country.
That's right. Now, on a lighter note, how would you describe your contribution to the government and people of Montserrat?
I think over the years I have been a reliable, always present, constant. I've hardly not, well, I've kept my appointments with the people of Montserrat. I think I managed to last 10 years because no one found it easy to tell me I'm not doing my job. When I come to Montserrat, I follow the instruction of the nurse who's working with me. She come up with the list of patients I need to see. Anywhere she tells me to go, I go. I never sit down in the clinic. I go to the homes. I go in the streets. I put my patients in my vehicle. I take them to the health center. So I would say the passion that I have practiced, with which I practice psychiatry in Dominica, and the fortune I had in Dominica of working in a different system than most of my colleagues working in the Caribbean. I work in a regional hospital with a psychiatric section attached to that hospital, and I work in a community. So coming to Montserrat, there was no regional hospital. It was just a community. I found it was very easy to work in that system. Very few psychiatrists are comfortable going on the streets or going to people's home, patients who can hurt you if they have a mind to. But I found it very easy to argue with a Montserrat patient. I found it very easy to get pushed and still stay standing. I find it very easy to be attacked by anybody in the public and still remain available to the people. So I think my contribution is that I felt I belonged I felt I belonged. I felt I talked like a Montserrat man. I felt I could argue with any Montserrat man who wanted to argue with me. When I met the chief minister, I didn't have to change my accent and my tone to talk to him. And some people think I was, well, you know, you're putting on because you're really not from Montserrat. But I enjoyed it, and I felt this is my contribution to Montserrat.
Okay, but Dr. Benjamin, your clients now would have developed a strong bond with you over those years. Are they aware that you may not be?
I deliberately decided not to tell a single client I was leaving.
Okay.
It is not the norm. When I was being trained, I was told that you have to end formally your relationships.
Right.
I didn't understand the ending part of the relationship, so I told the PS that she will have to inform everybody. But before I go, though, I must say special thanks to the Ministry of Health for having confidence in me and allowing me to work for as many as 10 years. Mm-hmm. I want to especially thank the very first PS who I worked with, Development.
Okay.
She and I negotiated very well. I used to sit and talk to her with her long. My friend, Mr. Silcott, Elijah Silcott, I'm very proud of our relationship. There's one special friend that every time I come to Montserrat, everybody in Montserrat know, Mrs. Fergus, Terry Fergus. She's the head of the social services. I have enjoyed my relationship. We worked together from day one when she was a counselor at the school. Mm-hmm. So when I did the pupil support program, she was with me there. Mm-hmm. And then she came to Ministry of Health and Social Services, and we worked very well there together. In the recent years, I think the chief medical officer has been a very inspirational guy to me, despite the confusion sometimes. All I have to do is call him, and he would clarify most things. And so I enjoyed. In terms of mental health nurses, I think I am confident that Nurse Lane, who was trained while I was working here, could continue to do a good job. I hope she gets a good psychiatrist to work with. And I hope she continues to develop. Linda Diaz worked with me at the beginning. I'm leaving and she's back. I don't know if she came to see me off. But she's still young and strong, and I'm sure she can volunteer to be more active with the government of Montserrat. But I have enjoyed myself in Montserrat. I have a lot of friends out there who I'll miss, and I'm sure I'll be coming back to Montserrat.
All right, Dr. Benjamin, thank you so much
My
for consenting to this interview and, of course, for your contribution to the government and people of Montserrat. Thank you.
My pleasure. Thank you.
Thank you for listening and viewing this GIU interview. I am Viona Alexander-Smith.